Good evening, everyone. Good evening, Docu. This is my answer in quiz number 2 on health psychology. Number 1 question is, what is health psychology? Health psychology examines how biological, social, and psychological factors influence health and illness. Health psychologists use psychological science to promote health, prevent illness, and improve healthcare systems. The field of health psychology is focused on promoting health as well as the prevention and treatment of disease and illness. Health psychologists also focus on understanding how people react to, cope, cope with, and recover from illness. Number 2 question is, explain the roles of the health psychologist. Health psychologists study how patients handle illness, why some people don't follow medical advice, and the most effective ways to control pain or change poor health habits. They also develop healthcare strategies that foster emotional and physical well-being. Some health psychologists work to improve the healthcare system and the government's approach to healthcare policy. And for the last question, discuss the behavioral interventions that the health psychologist can do. In behavioral interventions are interventions designed to affect the actions that individuals take with regard to their health. The typical medical intervention is a clinical trial of a particular drug, surgery, or device. In the trial, doctors provide different services to different people and then evaluate the outcomes. Variation in patient behavior is generally shunned, and strong emphasis is placed on making sure that patients do exactly what is expected from them. With behavioral interventions, in contrast, patient behavior is the key and the goal is to change it. In considering issues such as the high rate of preventable illness, this is McGinnis and Fogg in 1993. The racial disparities in health, behavioral interventions are key. This chapter reviews that is known about the success and failure of behavioral. Continuation for number 2. This chapter reviews what is known about the success and failure of behavioral intervention and speculates about why some interventions are more successful than others. Behavioral interventions can be implemented at three levels. Number 1 is the first individual level. This intervention encourages people who are at high risk for a particular disease to do something about it. Samples are programs to encourage smokers to quit, hypertensives to take medications, or diabetes for to exercise. These steps involve lifestyle changes, eating well and exercising, and medical changes, regular testing of blood pressure and cholesterol. In both cases, though the actions taken are controlled by the individual. That's all. Thank you.